Life in a world that keeps changing. Think that it's progress you're making. Copy and paste pretty faces all the time.
Hi lovely, this is Nelly. Welcome to my channel. This is like 4 to 6 hours update after surgery. So I don't know if I actually told you guys what happened in the surgery unit. I was in there, you know, they gave me a spinal since I was not doing vaginal delivery. They give you the guys, my pain, they give you the epidural block, but they gave me a spinal, so they wheel us back here. And you know, when you get out from the surgery, for the first hour, they will check your vital signs for every 15 minutes times 4. Every 15 minutes they will check your vital sign, which is your blood pressure, your pulse, oxygenation, that means your oxygen saturation in your body, to see where you're at. And after that, they will do every 30 minutes for, I think every 30 minutes for 2 hours. Am I right? After that, they will do every 2 hours. Then after that, they will do every 4 hours for 24 hours. They will check your blood pressure every 4 hours for 24 hours before every shift. They're no more concerned about my blood pressure. During my hospital visit, it has been normal, and even now it's still okay. No signs of any protein. They are not worried about it, you know. So I think the more you get older in age, I believe there are more risks for complication. Now, don't get me wrong, every C-section has risks. I signed the paper immediately I came here. Risks for infection, risks for bleeding, and risks for blood clot. But they try their best, you know, to control everything. And as they're checking that vital signs, which is your blood pressure, your pulse, temperature, they want to know, those numbers actually give them hint of what is going on in your body, you know, because of the spinal. So, you know, your diastolic, which is the lower part of your blood pressure, will drop down. So as they are checking that, they will also be checking your uterus to see if it is firm. They want it to be firm, because if it is firm, it means that the pitocin, which is here, you see the pitocin, that helps the uterus to contract. So when they are checking that, they press on the belly button, or they press that and they'll be checking to see if you are bleeding. They don't want to see a clot. Now, if they see a clot like the size of, just like this size, it's okay, but they don't want to see something bigger. And if your uterus is soft, it means that some blood clots might be hiding somewhere in your body, and that might cause hemorrhage. So as they are checking your blood pressure, I think assessment, where they push your belly and they will tell you to take a deep breath. This is like primary care they're supposed to give to every woman that does C-section and every woman that goes through vaginal delivery, because whichever way you're having your baby, you are going to bleed down there in your vajayjay, you know. So they press your belly button and they try to check your uterus to see. They want it, the goal is they want it to be firm, and they want it to be going down. But after 4 to 6 hours after delivery, they don't expect it to go down past your belly button, but they want it to be firm. So they will tell you to take a deep breath, and they push down, touching the uterus, top of the uterus, and, you know, checking to see what is coming out from you. Like I said, they are checking for the amount of bleeding and clots, you know, which they will measure to see the amount that came out. This thing is supposed to be running for 8 hours, so they will take it off in the next 8 hours. Like I said, that pitocin helps your stomach, your uterus to contract, and the baby is going to be having her first bath. You know, the nurse will take her in there to have her first bath. She's gone, and you saw her when they wheel her back here. Hubby has been very supportive, and he's sitting over there with the baby. You see him. So when I came out from the surgery, my legs, I couldn't feel my legs. This is my legs now. You can see I'm couldn't feel my legs before. Belly, you see, this is my belly. It's down now, and I'm having pain down there, but they gave me ice to put here. They gave me ice. Yeah, I don't know if you guys can see. I have ice pack on my incision line. And this is the IV line. They've been giving me pain medication through this IV line. And this thing is where they connect my husband, baby, and me. If somebody is to take the baby out, you know, for security measures, safety measure. If anybody is to take the baby out towards the door, this alarm will blink. This alarm will make noise. Yeah. And so when I came into the room, they gave me ice chips that I ate. You know, I'm not supposed to eat after surgery because, you know, when they gave you the spina on your back, it actually stopped everything in your body from down here, like from my ribs bone down. It stopped everything from my body, so my digestive tract was not functioning because they needed to get the baby out. And I believe this surgery was fast. When they took the baby out, it was fast. And the only thing I noticed was the stitching. They had to take their time to like stitch me up. They use invisible stapler? I don't know if that's the right word, but I'm not an OB nurse. I'm just a general geriatric nurse, you know. So they use a stapler to, you know, staple me in. And I asked the doctor to, I was skeptical about my scar. What I mean is, if you're doing C-section, sometimes the way you heal your scar tissue, that place they open you, because they've opened me 3 times on that same spot. Sometimes it has scar tissues, and if that scar tissues are not looking very well, sometimes it might even stop you from conceiving next time because it will glue to other place. So when I asked him, each time this doctor that delivered this baby, delivered Sophie, I always ask, and I think if you are a candidate for C-section and you've done C-section before, repeated C-section, please, when you go in to get a C-section, a repeat C-section we do, always ask about your scar tissue. Don't do it very well. That can cause infertility. I'm not a medical doctor. I'm telling you that is true. And this has happened to somebody I know. They have to go in back to do another surgery. So please, and you can check it online too. Google can tell you if the scar tissue on your incision, in your womb, is not properly, it can glue up. So always ask for how your scar tissue is looking. I don't know, in one of my videos you will see me asking, and the doctor said your scar tissues are looking okay for a person that have done 3 times C-section. They are looking good and you're fine. And he also asked me if we're going to do a tuber, like to, you know, tie my tube, and I said no, because I think I have to go for one more baby, you know. So when I came in here, let me continue. When I came in here, they gave me ice to mount on because I asked for it and I was testing. So yeah, these are the things I've been mounting. I was able to tolerate you know, the food, because after surgery you're not supposed to eat till you get your stomach, your digestive system back in track. But so far I've ate the ice and everything, nothing happened. And the way they will come back to assess you to see how you're progressing. And if you're progressing very well, they ask you to, they will give you the bland food. So here I have orange juice and this toast. Like I said, I already ate my snack before she would come by. I told my husband to bring the snack. I started eating it, and I did so well. And they gave me a gas pill to help with my stomach. And you can see how I'm expected to get more puffy because of all the fluid they give to me. Please ignore that noise. That's the vital sound machine. So giving me the normal IV is just to keep my body hydrated. Like, they want my body to be fully hydrated because of the spinal medication they put through my body during the surgery. They want you to be fully hydrated. So by tomorrow you'll see how puffy I'm gonna be. It's expected. Okay, my stomach is already down, like you saw. I just showed you, it's already down, you know. And my pain has been controlled. Like, they gave me Tylenol, which in African Nigeria we call paracetamol, 1000 milligram, and they're giving me narcotic, which is a control medication, and it's called oxycodone. I kind of refused it because I don't want to be constipated, but she said they're going to give me medication to make me go to toilets. You know, I don't want to force myself going to toilet. And I have my, you see, catheter. They put this catheter in me when I went into the surgery, and they're going to take it out in the morning. They'll take it out in the morning. This is already 2 o'clock right now. So at 6, they will come walk me to the bathroom. This is the update 4 to 6 hours after surgery. And I'm doing so far. You can judge from the way I talk. My pain is really controlled. My husband has been so supportive. I can't ask for more. Yeah. But sometimes, you know, couple, we still have our little argument and the rest. Baby girl is so calm, and I think but hubby is already in love with her. He says she doesn't cry much. We'll see how time go. But so far, that's Mr. White Lion. Yeah, say hi, babe.
Yeah, what's up, guys?
What do you think the baby look like?
Me, of course.
Okay, guys, we'll see so far. But the baby kind of look like Sophie. But anyway, that's Mr. White Lion.
Sophie look like me.
You know, doing his
Thanks,
daddy's duty. But anyway, if this is your first time, you know, tuning to my channel, why don't you consider subscribing and join this beautiful family of mine. I know you're not going to regret it. I'm done with the journey of being pregnant. I just want to give you an update, what you're going to be expecting and what has happened so far. And I'm impressed with the nurse that I'm working with this shift. She's so on top of it, you know. Like I said, I have ice pack on my incision line here. They give it to you. So I'll keep you guys updated. Like I said, this is the 4 to 6 hour update after surgery. You do not want your stomach, and if you are doing your surgery anywhere, always know that they need to press your stomach to make sure the uterus is firm. They don't want it to be buggy. If it's buggy, it means that you might be hemorrhaging. Hemorrhaging means bleeding somewhere. So far, she's okay with me. My vitals have been stable. Everything has been fine. And I'm doing well. Thanks to God. Thanks for watching my video. Thanks to my husband and everybody who have prayed for me. I love you guys. Bye-bye.